And as both of us know, 74% of all global deaths every year is due to NCD. So we have a huge job together to do.
We need to invest to protect our patients. We know that early diagnosis is a cost-effective measure rather than treating those with advanced disease.
So you were mentioning the targets, and if we look at the targets for example, diabetes now, and we also have very clear targets for cervical cancer. But if we use again the example of diabetes, 3 of the 5 adopted targets actually has a need to increase the access to measurement for blood glucoses and HbA1cs. And this is one of the big breakthroughs, which again we learned from HIV, is that we now have the community of people living with diabetes as we have for cancer, and also will set up for people with hypertension that guide us. And they are very, very clear. We cannot have access to medicines without self-monitoring, and it has to be at high quality level, and it has to be also with the support of educated healthcare personnel, and also with the focus on health literacy for the patients themselves.
When talking about barriers to access, they can be very different depending on the country or the region in which you're talking about. It could be a pricing issue, it could be a health system issue, it could be a regulatory issue.
If a technology has to be adopted in a public health program, the cost essentially has to be really, really low, so that the programs are then able to offer the technology free of cost.
And I would have to say that access to better diagnostic tools had a big impact on me improving my condition and the quality of my life. If we listen to everyone's voices, I believe in the end we're going to be able to make a successful shift in our community.
So much of what you said should be fed into health systems to improve them and to make them better and more patient-centric. The knowledge of patients is incredibly important to improve policy, to improve delivery of services.
And so this is a great moment to be trying to really influence and persuade governments that they need to spend more on health, they need to spend more on primary health care. And I think what we did in the Lancet Commission was also to show how to spend better on primary health care as well.
We are on the cusp of a new wave of technologies that are designed for these settings for primary health care, where patients can come in with symptoms and they can get their disease diagnosed in a simple test across a range of multiple diseases. We can make enormous progress as long as we can, as you say, build the right coalitions, make sure it's informed by what patients and providers really need, and driven by a local prioritized agenda.
There's all these different flows of money that come from donors and from government and out-of-pocket payments, and I think finding ways that will kind of align resources around a clear set of strategic objectives, I think, is really important.